Your patient's blood pressure is 195 over 90. What are you going to do? I got a lot of great feedback in my hypotension critical thinking scenario video, and so I thought we could do the opposite and do hypertension. The alarms are dinging, your patient's blood pressure's super high, you're in the room, you're, taking a look at your patient, you're asking them questions. Hey, how's it going? How you feeling? As I'm talking to my patient, I'm also going to be assessing if that initial blood pressure is accurate, and I'm going to be recycling that blood pressure or getting a manual blood pressure. Your patient may be symptomatic with a high blood pressure like this, or they may not be, but regardless, this blood pressure, we need to do something about it. Right off the bat, we're going to be thinking about why. Why is my patient's blood pressure this high? Is there an obvious reason? Like your patient is in 10 out of 10 pain and they're writhing around and they're screaming because they're so uncomfortable. That would be a good reason why their blood pressure might be super high. Or maybe your patient's anxiety is through the roof and so their blood pressure is super high. And I'm adding this in because if there is a reason why your patient's blood pressure is that high, like they're in pain or they're anxious, maybe there's something else that we can do to treat that high blood pressure without giving them an antihypertensive initially. So once we've kind of ruled out that those would be like the causes of their high blood pressure, we're going to start thinking about other reasons why your patient's blood pressure is high. One, your patient might be hypertensive. I can't tell you how many times patients come into the hospital, they haven't taken their blood pressure meds in, maybe they just didn't take them that morning, or maybe they just don't take them in general. And so you're like, okay, yeah, you are a hypertensive patient. Like, we need to treat your hypertension. Another common reason are your dialysis patients that miss dialysis or they're super fluid overloaded. Just like hypovolemia can cause hypotension, hypervolemia can cause hypertension. The first thing I'm going to do as I'm troubleshooting all of this is look to see if there's anything as a nurse that I can give this patient to bring their blood pressure down. I'm also thinking for this specific patient, what is their blood pressure goal? There are some conditions where we want to allow for permissive hypertension, meaning we are okay with having a blood pressure a little bit higher. But truly, I don't know a condition where we want the blood pressure to be 195 over 90. So this is definitely going to be something that we treat. So I'm going to be looking if there are any PRN antihypertensive medications that I can give my patient, or maybe they have like a scheduled blood pressure medication that's due in an hour that I can just kind of sneak and give a little bit early. If I don't have any tools in my toolbox, aka medications that I can give to bring that patient's blood pressure down, then I'm going to be definitely connecting with the provider, notifying them of that high blood pressure, and getting some medication orders from there. And that's how I would go about treating a patient with hypertension. In case you've stuck around this long, I also want to mention that I have a critical thinking crash course that goes through a lot of these types of situations. That is literally what the course was designed for. So if you are wanting more of this, definitely go check that out.